Hi, welcome to a new video. Today we are going to talk about piles. Here with us is Dr. Aman.
Hi everybody.
Today we are going to see the most Google questions regarding piles. So the first question is, what causes piles?
So piles or hemorrhoids or bawasir, they are the same thing and are usually caused by dietary habits such as constipation or motion habits such as long sitting on the commode and using your phone or playing a game or trying to read a book on the commode. Being in that position leads to hemorrhoids or piles. And that's the most common cause. So again, repeating constipation or dietary habits leading to piles.
Alright. So is piles and hemorrhoids the same thing?
Yes, like I said, piles, hemorrhoids, bawasir, the same thing. Fissure, bhagandar, fistula, they're not the same thing. They're different diseases of the anal region.
Alright. Let's see the next question. What do piles look like?
So piles look like lumps, or you can call them grapes, or they are just small boils around the anal region, but they have an extension inside and outside. So piles usually are collection of blood vessels. These blood vessels get collected under the skin and they lead to formation of those lumps.
Alright. So the next question is for the gym buddies. Is whey protein good for piles?
So again, any kind of constipation is going to cause trouble. So piles can be present in a lot of patients. However, they might be asymptomatic. There might be no bleeding. There might be no protrusion of those lumps outside the anal region. But when constipation occurs, they get scratched, they get a little bit of trauma and the bleeding happens, or they are pushed out due to pressure while passing the stool. Any kind of protein, not just whey, any kind of protein-rich diet needs a lot of water and fiber to be digested for. So if your gym buddies are not taking enough fiber or they're not taking enough water while taking intake of protein, constipation will be a definite thing for them. And once constipation happens, yes, piles is going to be a cause of concern. Same thing happens with pregnancy. A lot of females, because of the weight, are not able to eat good fiber. Because of the baby being there, especially in the later part of the pregnancy, the motion tends to be very hard and constipation happens. That constipation leads to exacerbation or presentation of piles, which was already existing. However, now they are troubling you.
Alright. So the third question is, how to prevent piles?
So again, how to prevent piles? Number one, make sure that your diet is very good. Make sure that you're not causing too much pressure while passing stool. If a very good fiber-rich diet, a lot of fluids, say about 3 to 5 liters of intake of fluid, leads to a good healthy stool formation. Any kind of isabgol, trifla, these are also fibers, leads to better gut bacteria. दही या आलू जो हमारे नानी बोलती थी कि ये खाने से पेट साफ रहता है, that's actually because the gut flora becomes better. Yakult is the biggest example for it. Any kind of bacteria for the gut is healthy. That healthy bacteria leads to good stool along with fibers and water. If you have good stool habits, you will not have piles at all. Having piles leads to being present there, and they might not cause any kind of symptom. So prevention and keeping them away from symptoms is two different questions, but you can prevent piles by having a very good healthy diet. So how to prevent piles? I'll answer this question in two ways. Number one is when you don't have any grade of piles and there are no piles in your body, having a good healthy diet with a lot of fibers and a lot of water. Make sure that your stool is normal. If your stool is normal, you will not have piles. The collection of blood vessels will not lead to formation of lumps, which is actually piles or hemorrhoids. That way you can prevent piles. A lot of fiber along with gut flora, that means bacteria for the gut, dahi, doodh, chach, Yakult, these are good microbes for your gut. They lead to healthy bowel. That healthy bowel is going to make sure that your stool is normal, and that way you can prevent piles. Second is when you already have a grade of piles, that's grade 0, 1, 2, 3, 4, whatever grade it might be, you can prevent that grade from growing from first grade to second grade or second to third by making sure that you avoid constipation. If you don't have constipation, if you're not straining while passing stool, you can make sure that you halt the disease of piles, and you make sure that that collection of lump or the collection of blood vessels forming lumps doesn't progress to a next grade. You can't make it disappear, but yes, you can make sure that it doesn't cause you any trouble in the coming future.
So I wanted to ask that, are internal piles more dangerous or are external piles more serious?
So very good question. Piles can be internal and external. हमारा anal region जो the anal canal is differentiated into two parts. One is the outer portion where there is pain sensation or there is a touch sensation, and there is an inner portion which we don't feel or there is no sensation there. Internal piles are usually inside and in the inner region. So those piles don't cause any kind of pain. Whenever there is bleeding also, there is painless bleeding because the scratch doesn't cause any kind of pain. That pain, when it's painless, people tend to ignore and don't take care of their bowel habits, still have constipation, and the disease progresses from grade 1 to grade 2 to grade 3, and so on and so forth. However, the external piles are in the region जहाँ pain sensation होती है. Because there is pain sensation, patients tend to come and visit us early. Because they are able to visit us early, we are able to treat them early. There is no difference in which is more dangerous or which is more safer, nothing like that. Both are diseases that you need to treat, but patients present early with external piles because they have more discomfort while passing their daily stool.
All right. So the third question is, what cream to use for piles?
So again, piles, we have to understand the disease of piles is because there is collection of blood vessels. This collection of blood vessels with any kind of cream will not go away. Whatever cream we use, whatever ointment we use, be it Enovate, be it Pilex, be it Lignocaine, it's only going to cause us symptomatic relief. तो अगर हमें पेन हो रही है तो हम कोई एक एनेस्थेटिक जेली यूज़ करेंगे. अगर हमारी स्वेलिंग बहुत ज़्यादा है तो हम कोई स्टेरॉइड जेली यूज़ कर सकते हैं. बट दैट्स नॉट द ट्रीटमेंट ऑफ पाइल्स. There are multiple jellies or ointments available over the counter, and there is a huge list of them. However, that's not the treatment of piles. It's only to buy time कि आज हम नहीं treat कर पा रहे हैं, कल करनी है या परसों करनी है. So those are the only ways I will answer that. What cream to use for piles.
So the next question is, does eating fig or any kind of fruit or veggies cure?
So again, I don't know how this is the most common Google question. Nobody eats fig. Fig is अंजीर, I'm assuming, but इतना तो कोई खाते भी नहीं है. But yes, any kind of fiber helps in forming good soft stool. Anything that helps in formation of soft stool, चाहे वो stool softener हो, चाहे वो good fiber हो, चाहे isabgol हो, चाहे tripla हो, चाहे कायम चूरन हो, चाहे fig हो, helps in formation of soft stool. If you have soft stool, your piles or your passage of motion will not need straining. If there is no straining, you will be able to easily pass stool. Once you are easily able to pass stool, piles will not increase or will cause any trouble.
So my question here is, can smoking aggravate piles?
Again, smoking, sometimes there are patients who are now habituated that till I don't smoke, I won't be able to pass stool. If I smoke, my bowel is better. Yes, those habits are formed, but yes, smoking and piles have no relation. The only thing that you need to understand is that constipation is going to trouble you with piles. So if your smoking leads to constipation, please make sure that you're not smoking.
All right. So the last question here is, does cold compress cure piles?
So again, I like the question here again. It's a very simple question. Does cold compresses cure piles? No, it doesn't. The answer is a very straightforward no. There is no cure for piles other than making sure that the lump or the blood vessels disappear. How those blood vessels disappear is a different question and we can answer them later. But cold compression can only give you relief to making sure that those pile lumps decrease in size. There are patients whose pile lumps just come out and stay out and they're not going back in now. So those cold compressions help in those patients, because with cold the blood vessels decrease in size. Because they decrease in size, those lumps become small and they might go back in. So there is a lot of pain relief with cold compression. There are some methods which were tried because cold compression used to give pain relief, such as cryotherapy for piles. However, it's not been very successful because that is not the main surgical treatment for piles.
Alright, so my question here is, what happens if we do not treat piles?
So again, treatment of piles depends upon the grade of pile that you have and also on the symptomatic. If you have grade first, which is only bleeding and it's only happening once in 6 months, make sure that you're having a good healthy diet, change in your lifestyle, sleep better, have a good water intake. You might be able to halt the disease at grade 1. If it progresses to grade 2 or grade 3 in the coming say 2 to 3 years, you should definitely make sure that there is a surgical intervention needed here. Piles in the anal region happens at mostly 3 places. That's a 3 o'clock position, 11 o'clock or a 7 o'clock position. So these are places, if you look at the anal region like a clock, you can identify these 3 places as the most common area for piles. Again, the treatment for piles is majorly surgical. Now that surgical can be divided into a stapler, open or a laser technique depending upon what grade of piles you have. The earlier you treat, the lesser invasive treatment you can benefit you. Grade 2 best probable treatment is laser. Grade 3 maybe laser and stapler or a mixture of both. Grade 4 depends really. If somebody is very skillful, they can treat it with staplers and probably laser. But a grade 4 usually sometimes might need an open surgery as well. So the earlier you report and get treated or get at least diagnosed with piles, you will be able to monitor your disease. You will be able to make sure that those changes that you bring in your lifestyle will ensure that they don't progress or the disease doesn't progress further. And once you've made sure that your diagnosis is there, you can treat it early. Early treatment is always better.
Alright, so this brings to the end of the video. It was
I'm sure there is a list down there as well, but
Yeah,
this is what we can show you here. So thank you then. Thank you everybody. If you have any questions, just feel free to ask in the comments. Happy to answer them.
Make sure you like, share and subscribe the video.
Thank you. We're back on the video because the director has told me to say like, subscribe and share. So please kar do yaar.